right, Dr. Alexander, man, this is February, Black History Month. Miles for Smiles is a unique service provider in the dentistry industry.
Mm-hmm.
As a African American owner of this, man, talk about that journey and your why to bring this to the community.
Well, it is Black History Month, and I think it's a great topic, to bring up, mobile healthcare, dental care in our community for all communities, but as a owner, African American, Black American dentist in this area, to bring this type of services back home, meant a lot to my family, first and foremost my family. Being born and raised here in Shreveport, Louisiana, being able to come back home and offer services to the community at large, Shreveport, Bossier. I still look at it as Shreveport. I grew up here, so I don't really separate the two, but to come back home and do something positive to help others. And that's really what we call it, impactful dentistry, for a reason, because it gives us the opportunity to impact lives, man. And just to highlight the fact that it is a Black-owned business, because it's Black History Month, we want to talk about that, but it's for everyone. Our services are for everyone, and it means a lot for us to represent our entire community. So we try to make sure that our team is diverse and looks like the community that we serve, man. And so it's been a blessing. We started these services in 2015, October. And so, how many years that's been? About 8 years, maybe 8 or 9 years. And every year we've continued to grow as an organization, continue to make even more of an impact, partnering with other people in the community with similar passions. A lot of times, when your work, I guess, is starting to kind of speak for itself, you attract other people who have the same type of purpose or vision for what they're trying to do. And our vision has always been to impact and help people through the art of dentistry.
Let's talk about the history of the Black American in dentistry. From your experience, maybe some research that you may have known, the stigma that exists even just between children and going to the dentist. What have you seen, and what does Miles for Smiles do to kind of bridge that gap and create more of a comfortability between?
Well, I think that's a complex question. I think on a personal note, and I would say maybe more so with the adults that we see. A lot of times I get that affirmation from adults that may look like me, that they want to go to a Black dentist. I don't necessarily get that from kids. Kids, in a sense, they have such a different, it's such a big spectrum, man, of how they view the dentists, how they view doctors. A lot of the times the kids that we see, this is their first time ever going to a dentist, or maybe their second visit, maybe their first visit. The consistency of care, and that's really why we formulated this company, is to try to provide more consistency of care. So even though a kid may have went to the dentist when they were 3 or 4 years old, sometimes their next dental experience may not be till they're 7 or 8 years old. So a lot can change in those years, and so these kids are just kind of happy to see dentistry being done amongst their peer group at their schools. It's a healthy environment where they're comfortable, and that's kind of the backdrop of what we're doing as an organization, as a service provider. We're trying to meet people where they are, and these services were definitely created to meet K through 12th grade students initially where they are at their school site, to bring about some familiarity with their comfort zone, to help them to get these type of services amongst their peers, to try to combat some of that fear or anxiety they may have about going to the dentist. And one of the things that I like to tell people that is kind of an unwritten or unknown about our services, some of these students who have learning disabilities or health issues that are guided through life daily by paraprofessionals or people at the schools who kind of help the aides, teacher aides, that help these students specifically every day. Well, by us going to some of these schools, these particular kids benefit from these services as well, because those people come to the appointment with these kids. And a lot of times we get to do more on them because that person is there. So I like to all the time I thank them every time they come out to the mobile and help us with those visits because it's going to be hard for that particular child to have that person with them when they go to a traditional dental environment away from school. And it helps the parents greatly. So I think that's one of the secrets when we talk about school-based healthcare or dentistry, that it is a community, it is a partnership, it is a collaboration with all the stakeholders involved in the overall health of our kids.
First black mobile dentistry in Shreveport, Louisiana. How does that make you feel?
Man, I mean, I'm proud. At the end of the day, I'm always proud of doing something that I feel to help others. That's always been my passion. It's not so much about me, and I didn't do any of this to think about myself as a whole of what I'm personally doing, but it's more about just trying to help people, man, and provide opportunities for people, whether it be through employment. I think we try to have a different approach to dentistry than traditional practices, that I've owned or been a part of. Just trying to make dentistry more convenient, more accessible within itself is a mindset that we have as an organization. And so we try to make it fun, man, try to keep it light, and the kids make it exciting. We have new team members that's joining the company all the time, and one of the first things that they tell us are, when they get a chance to express themselves or why they like working with their organization or being a part of it, is just the freshness of it, the difference that it feels, the true rawness of being around our youth and our kids and their excitement and the questions that they ask, and just being able to be involved in their history, their upbringing. We hope years and years from now, man, when they look back, when some of the people in the community approach us later on, maybe then it'll sink in, later. Right now, we're knee deep in the work, man. So I really, to be honest, I don't sit back and reflect on that. I just want to make the impact. Maybe one day I'll sit back and if somebody else can tell me how good we're doing.
Part of your impact beyond what you're doing for the oral hygiene, the dental health, is also being a mentor and example for other kids that look like you and other races, minority races, to aspire to something bigger. Is that part of something you're aware of right now?
Well, I think we always want to be a bridge, right? So we want to build bridges for people to kind of cross over. I look at my grandparents and the examples that I've had and parents of just, trying to bring people with you. The things that I'm constantly researching and reading and trying to put in my brain now is it's a collaborative. It's I may not quote it right, but I think you say you go further together than by yourself. So I've always, and I tell people who come in for interviews and talk with me, man, we can't get any of this done by ourselves. So I've never had the mentality of it's me, it's me, it's me. It's definitely, it takes all of us. Everybody that's a part of this organization to bring their talents and gifts daily for us to keep pushing and moving the needle forward.
What service that Miles for Smiles offer that you think that the community may not be aware of?
Well, I think the main thing is that it's a comprehensive, that we provide every service that we possibly can to create overall health and wellness in the patients that we see, especially in our youth. Being on a mobile unit for the most part, I think there's still a misconception of how effective our services can be, what our services are. It's not just a cleaning service. We pride ourselves on being able to treatment complete our patients. Providing comprehensive care is we don't, like I tell my quick answer is I tell everybody we do everything that we possibly can on a mobile besides braces. So anything that you can think of that can be done in a traditional dental setting that you've experienced in the past, we do this on the mobile as well. And we also, as you can see, we also have our traditional practice as well to do, even to offer even more options for our patient base.
Is there anything else you'd like to add?
Man, we're growing. We're here. We're excited every day to bring these services. It's something that, man, that dentistry, I tell people all the time, dentistry is not a glamorous profession. It's something that we get to do. You know, we get to make this impact. You know, my first experiences with mobile health care that really changed my heart for it, just as a dentist as a whole, was just, you know, as a dentist, I don't really do a lot of cleanings physically. You know, that dental hygienists particularly do a lot of your dental cleanings in the dental setting. But that first day that I went on dental mobile, and I actually just didn't know what I was doing. I did a cleaning on a young lady, and I still remember her face. I kind of still remember what she had on. Still kind of remember the mood in the mobile. And after I cleaned her, then I gave her, it was either a pencil or a toothbrush. And this young lady gave me a hug, and I still remember that hug. And that's what we're here for, man. To just get back to the pureness of what we do and the why. And the why really is just to help people, man. To honestly get back to helping people, to getting that affirmation that you know that you're making a difference. And honestly, for me as a dentist, I wanted to get out of selling dentistry. I can care less about trying to convince someone to take care of their teeth. You know, I want to be able to just, for myself, know that when I look at someone and I have the opportunity to improve their health, that I can do that without trying to convince them or sell them on the profession of dentistry. So that's what brings me the greatest joy.